Welcome to Heart Attack Awareness. If you're new here, don't forget to hit that subscribe button. We release weekly videos designed to help you protect your heart, understand your risks, and make better choices, especially if you're over 50. Today's video is one of the most important we've ever made because we're answering a question that confuses millions. What's the real difference between a heart attack, cardiac arrest, and heart failure? These terms are often used interchangeably in the media, but they're not the same, and knowing the difference could save your life or the life of someone you love. Let's begin with the most familiar term, a heart attack. A heart attack, or myocardial infarction, occurs when blood flow to part of the heart muscle is blocked. This blockage is usually caused by a buildup of plaque made of fat, cholesterol, and other substances inside the coronary arteries. When one of these plaques ruptures, a blood clot forms and cuts off circulation to a section of the heart. That part of the heart muscle is starved of oxygen and begins to die. This is a medical emergency, but the heart doesn't necessarily stop beating during a heart attack. Symptoms of a heart attack can vary, but classic signs include chest pain or pressure, often described as feeling like an elephant is sitting on your chest, shortness of breath, nausea, cold sweat, and pain radiating to the left arm, jaw, neck, or back. Women and older adults may experience more subtle symptoms like fatigue, dizziness, or indigestion. A heart attack can come on suddenly, but it often follows a period of cardiovascular decline. Years of high blood pressure, poor diet, inactivity, or smoking that narrow the arteries over time. Now let's talk about cardiac arrest. This is what happens when the heart suddenly and unexpectedly stops beating. It's not a circulation problem like a heart attack. It's an electrical problem. The heart has its own electrical system that controls rhythm and pumping. In cardiac arrest, that system malfunctions. The most common cause is an arrhythmia called ventricular fibrillation, where the lower chambers of the heart quiver instead of pumping. When this happens, blood stops flowing to the brain and other organs. The person loses consciousness within seconds, and without immediate CPR and defibrillation, they will die within minutes. Cardiac arrest can be caused by a heart attack, but it can also be triggered by other conditions like long QT syndrome, cardiomyopathy, drug overdose, or severe trauma. It can happen to someone with no prior symptoms or warnings. That's why knowing CPR and having access to an automated external defibrillator (AED) in public places is so critical, because survival depends on seconds. If you see someone suddenly collapse, lose consciousness, and stop breathing normally, don't hesitate. Call emergency services, start chest compressions, and use an AED if available. Heart failure is something else entirely. Heart failure, or congestive heart failure, doesn't mean the heart has stopped. It means the heart is weakened and can't pump blood as effectively as it should. The body's organs don't get enough oxygen and nutrients, and fluid can build up in the lungs, legs, or abdomen. This is usually a chronic condition that develops over time, not a sudden event. It can be caused by damage from a previous heart attack, high blood pressure, diabetes, or even heart valve problems. People with heart failure often experience fatigue, shortness of breath, especially when lying down, swelling in the ankles or legs, rapid weight gain from fluid retention, and a persistent cough or wheezing. Heart failure can be managed, and in many cases improved, with lifestyle changes, medications, and sometimes medical devices. But without treatment, it tends to worsen over time. So let's pause and recap. A heart attack is a plumbing problem, blocked blood flow to the heart. Cardiac arrest is an electrical problem. The heart stops beating suddenly. Heart failure is a pumping problem. The heart is weak and can't circulate blood properly. 3 different problems, 3 different treatments, and 3 very different outcomes if not handled correctly. One of the reasons these terms get mixed up is that they can be connected. A heart attack can trigger cardiac arrest. Heart failure can result from years of small, unnoticed heart attacks, and people with a history of cardiac arrest often have underlying heart disease. But confusing the terms can lead to dangerous delays in treatment. Imagine someone goes into cardiac arrest and someone nearby says, "He's just having a heart attack." That misunderstanding could delay CPR and cost a life. Let's go a little deeper. During a heart attack, the heart muscle is still beating even as part of it is being damaged. The key to survival is to restore blood flow quickly, with clot-busting drugs, angioplasty, or surgery. The sooner the blockage is cleared, the more of the heart muscle can be saved. That's why it's essential to call emergency services immediately when symptoms appear. Many people delay because they think it's just indigestion or fatigue. But minutes matter. Always err on the side of caution. Cardiac arrest, on the other hand, is all about timing. Without CPR, the chances of survival drop by 10% for every minute that passes. That's why public education on CPR is vital. Chest compressions keep some blood flowing to the brain and organs until professional help arrives. An AED can deliver a shock that restores normal rhythm. In the best-case scenario, someone collapses, a bystander starts CPR immediately, and an AED is applied within a couple of minutes. That person walks out of the hospital a few days later. Without fast action, even a healthy-looking person can die in under 5 minutes. Heart failure is often more insidious. It develops slowly, sometimes over years. People might attribute the symptoms to aging or being out of shape. But if you find yourself getting winded walking upstairs, waking up short of breath, or needing to prop yourself up with extra pillows at night, don't ignore it. Early diagnosis and treatment can prevent serious complications. Medications like ACE inhibitors, beta blockers, and diuretics can make a dramatic difference. In advanced cases, implantable devices like pacemakers or defibrillators may be needed. Let me tell you about 3 people, real people whose stories show how important it is to understand these terms. First, there's Linda, a 58-year-old teacher. One morning, she felt intense pressure in her chest and nausea. She thought it was anxiety and waited it out. Hours later, she was rushed to the hospital. She was having a heart attack. Fortunately, the doctors were able to open the blocked artery, and she recovered. But she said if she had known the symptoms better, she would have gone in sooner. Then there's Marcus, 67, who collapsed while walking his dog. A bystander saw him fall, checked for a pulse, and started CPR. Another passerby ran to get an AED from a nearby gym. Within 3 minutes, Marcus had a shock delivered to his chest. He was revived on the spot. Doctors said he had a cardiac arrest caused by an undiagnosed arrhythmia. He's alive today because someone understood the difference and acted fast. And finally, there's Teresa, age 73. She had been feeling tired for months, chalked it up to aging. Her legs were swelling, and she couldn't lie flat without coughing. Her doctor diagnosed her with heart failure. With medication, a low-sodium diet, and daily walking, she regained her strength. She says understanding the signs helped her avoid a hospital stay and regain her independence. These stories show that knowledge is power. Understanding the difference between heart attack, cardiac arrest, and heart failure isn't just trivia. It's life-saving. And the best part is all 3 conditions are impacted by lifestyle. Eating better, staying active, avoiding smoking, managing stress, and seeing your doctor regularly can reduce your risk for all 3. If you're over 50, here's what you should do. Learn the symptoms of heart attack: chest discomfort, shortness of breath, unusual fatigue. Know how to perform hands-only CPR, just chest compressions, and find out where the nearest AED is in your workplace or gym. If you have high blood pressure, diabetes, or a family history of heart disease, get a checkup and ask your doctor about your risk. Monitor your blood pressure at home. Watch your weight. And take your symptoms seriously. Your body whispers before it screams. This has been Heart Attack Awareness. If you found this video helpful, please hit the like button, subscribe, and share it with someone who needs to hear this. Every week, we bring you science-backed information to help you protect your heart and stay healthy as you age. Stay informed, stay prepared, and take care of your heart.